So welcome to Adapting Class. This is a quick video just to highlight some information. I've seen some people struggle with this diagnosis, infectious control. You have to know it before you take your boards. But there are certain organisms that they try to trap you with wherever you go. If you go look for other questions, you see this kind of organism keep on coming back. There's a way there's a reason why they put it there to trap you. I got your back. This is what I'm going to give you. You need to watch this video. If you watch it, you will never go wrong with this kind of infectious control questions related to these organisms. They are traps. So which room assignment the chart then should question, right? So which one? You have a patient in room 1, put in Airborne, is diagnosed with Legionnaires disease. Why am I studying this question? This is a trap. This is a pneumonia. Fine. Is a pneumonia. It's a bad pneumonia, but it's not infectious. You don't transfer it to any other body. So what you need is a standard precaution. You don't need airborne. So this patient need to be questioned. Client diagnosed with hepatitis A, who is continent. Hep A is enteric. All enteric are contact. But what? This guy is continent. He can go to the bathroom and ease himself. Therefore, he should not need any contact precaution. It should be standard precaution. This is also standard. Client with HIV, it's not infectious unless you're doing something with them. You don't want that. So that's not something we want to do, right? And therefore, this should be standard precaution. The client with diagnosed with hepatitis B is the same thing with HIV. These are transmitted, it's sexually transmitted, blood-borne, vaginal fluid, semen, and then basically get in touch with your blood like using IV drug use. Therefore, this is also standard. Client diagnosed with mononucleosis. This is what we call kissing disease. You see it in college students. They go out and kiss each other, and they have swollen lymph node. The spleen can get bigger. The liver can get bigger, but it's not infectious unless you're kissing the person. The same thing, being intimate with the patient. So this patient, standard precaution. We also have to question. Client diagnosed with pneumocystis pneumonia. I know it's bad, right? Yes, this is pneumonia you get for immunocompromised patients. Patient who has like AIDS, patient who is on chemotherapy, immunocompromised. If you know immunocompromised, you're not going to get it. It's a fungal infection. Therefore, this also is the best one. It's a standard precaution. The next did right thing. So we don't need to question. You see what I'm trying to emphasize? All of them are standard precaution. So that's that one. The next one group is a client diagnosed with erythema infectiosum. This is fifth disease. This is caused by Parvo virus B19. It's a slap cheek rash in their face. Before they get a rash, yeah, the infectious you see it immunocompromised patient and usually droplet. But after the rash, to make the diagnosis as fifth disease, you don't need any precaution anymore. This is standard precaution. So fifth disease, erythema infectiosum, fifth disease, slap cheek, this is standard precaution. Client diagnosed with Wes Nile Virus, the same thing. Unless you're getting close to the birds, yeah, standard precaution. Client diagnosed with Bubonic Plague, standard precaution. Why am I doing this? You see these questions pop out all the time and you get it wrong. I don't want you to get it wrong anymore. Standard precaution. All of them are standard precaution. Take care of yourself and have a good day. Bye-bye.